Let's speak to Dr. Zubaida Haque, member of the independent SAGE group of scientists and the former interim director of the Runnymede Trust, a race equality think tank. Thanks for joining us. All adults to be vaccinated by July. I mean, that is good news, and presumably that will speed up the roadmap as it's described out of lockdown.
It's fantastic news, and it's a fantastic testimony to science and the NHS that we've vaccinated 17 million people. That's incredible news. But we mustn't relax. The problem is vaccination, while absolutely required, is not the whole answer to the problem. And that's because vaccination, while preventing severe disease, we're not entirely sure whether it stops transmission. So we still need a lot of restrictive measures to not only bring down cases, but to make sure that they stay down. And that's because unless we keep cases low, circulating virus, high rates of circulating virus means that there could be more mutation of the virus, and more mutation of the virus might lead to a vaccine-resistant virus. We've still got a long way to go with the vaccination program.
Isn't there some evidence, though, already emerging, suggesting that the vaccinations do prevent transmission?
There is some tentative evidence, but it's early days yet, Tim. We've still got the rest of the population, some 2/3 of the population to vaccinate. And we haven't even really talked about children being vaccinated, because that's also quite important. You know, if we don't vaccinate children, then we're still going to have high rates of coronavirus circulating, and that still might bring back more mutant cases, more mutant viruses, which means once again that the vaccine might not be as resistant. So we need to make sure that all the cases come down and they stay down. So at the moment, what independent SAGE are asking the government to do is not just to rely on the vaccination program, but have measures which have suppression virus measures which keep the virus down.
So you would support the government, though, in terms of the briefings we've had about these dates for relaxation to be aspirational dates, because they are going to have to rely on the data as well. And just on schools, if I may, do you think it was a mistake to get all the schools open again on March the 8th, or should that be staggered?
First of all, I want to say it shouldn't be about dates. It should be about data and how you open up safely so that everyone is safe. Now, we know, first of all, from SAGE, from London School of Tropical Medicine and Imperial College and ONS and others, that we can't open everything up all at once. We saw what happens when you do that last September. You know, this is our third lockdown. We cannot have another lockdown. So first of all, what we need to do is think about how we're going to do it. Now, with schools, what we need to think about is, at the moment, there's only 20% of 25% of primary school children in school, and yet they have the highest rates of prevalent with COVID cases at the moment. That's just with 20% of schools. So imagine what will happen if you reintroduce approximately 10 million children and school workforce all at once at March the 8th. We've already heard from SAGE that that's likely to kick up R above 1. So we do need to think about whether it's phased re-entry of different years of primary and secondary, or whether we have a rota class-based system where we have, one classes coming in 1 week and then another, or half the class coming in 1 week, half the class coming in another week, some kind of rota system so that all the children can come back, but not everybody is in school at the same time. The other thing I want to mention is we need to talk about safer school environments, safer working environments. And at the moment, the government have not said very much about how they're going to ensure that schools stay open. And one way of doing that is to have safer schools with smaller classes, better ventilation, more mask wearing among primary and secondary school children.
All right. OK, Dr. Zubaida Haque, thank you very much indeed. We'll find out more tomorrow. Boris Johnson's due to present the roadmap at 3 o'clock tomorrow afternoon, and then a TV address at 7. All of that will be carried here.